Life can be overwhelming, and mental health can often feel like a puzzle we're struggling to solve. Welcome to Just Medicate Me, a safe space where we dive into real conversations about mental wellness. Hi, family. Deborah Lee here. I created this channel to share tips, stories, and insights about navigating the ups and downs of mental health, from practical advice to personal stories to fostering a supportive community. Because mental health matters, and together we can find our balance. Join our community, subscribe, and let's take this journey together. Welcome back to our channel. Today, we're diving into an important and often misunderstood topic: borderline personality disorder, or BPD. It's a mental health condition that affects many people around the world, but it's often surrounded by stigma and confusion. So, in this video, we'll take a closer look at what BPD really is, its symptoms, how it's diagnosed, and most importantly, how people with BPD can get the help and support they need. Let's get started. Borderline personality disorder, or BPD, is a mental health condition that primarily impacts a person's ability to regulate their emotions, thoughts, and behavior. People with BPD often experience intense emotions and can have a hard time maintaining stable relationships with others. It's a condition that can cause significant distress, but it's important to remember that people with BPD are not defined by their diagnosis. With the right treatment, they can and do lead fulfilling lives. So, what exactly are the symptoms of borderline personality disorder? Let's break them down. One of the hallmark signs of BPD is intense emotional experiences. People with BPD can feel emotions very deeply, and these emotions can shift quickly. This might look like feeling incredibly happy one moment and suddenly feeling overwhelmed or depressed the next. Another key symptom is fear of abandonment. People with BPD often worry that they'll be left alone or rejected by others. This fear can sometimes lead to behaviors that might seem like attempts to hold on to relationships, whether that's through impulsive actions or dramatic expressions of emotion. Unstable relationships are another common feature. Because of the intense emotions, people with BPD can struggle with maintaining healthy, balanced relationships. They may swing between idealizing someone and feeling like they are being hurt or betrayed by them. Other symptoms include impulsive behaviors like risky actions, substance abuse, or spending sprees, and distorted self image. People with BPD often have trouble seeing themselves clearly, and this can affect their goals, values, and sense of identity. There's also chronic feelings of emptiness or not feeling whole, and some people with BPD experience self harming behaviors or suicidal thoughts. If you or someone you know is struggling with these symptoms, it's important to seek help immediately. Now, let's talk about what causes BPD. While no one knows for certain, research suggests that BPD is likely caused by a combination of genetic and environmental factors. For some people, there may be a family history of mental health conditions, which can make them more prone to developing BPD. Childhood trauma, Particularly emotional, physical, or sexual abuse can also play a significant role in the development of this disorder. However, not everyone with BPD has a history of trauma, and not everyone with a traumatic past will develop BPD. It's a complex condition with many contributing factors. Diagnosing BPD is not always straightforward. The symptoms often overlap with other mental health conditions like anxiety or depression. A mental health professional, such as a psychologist or psychiatrist, will typically evaluate a person's symptoms over time and look at their history of relationships, behaviors, and emotional responses. If you or someone you care about is experiencing symptoms like those I mentioned earlier, it's important to reach out to a professional for a full assessment. One of the most encouraging things about borderline personality disorder is that it is treatable. With the right support and resources, people with BPD can manage their symptoms and live meaningful lives. The primary treatment for BPD is psychotherapy, particularly a type called dialectal behavior therapy or DBT. DBT focuses on helping individuals with BPD learn new coping skills to manage their emotions, tolerate distress, and improve relationships. It's been shown to be highly effective for many people with BPD. Another form of therapy, called cognitive behavioral therapy, CBT, is also used to help people change negative thought patterns and behaviors. In some cases, medications may be prescribed to help with specific symptoms such as depression or anxiety, but there is no medication that specifically treats BPD. Along with therapy, support groups can be incredibly helpful for people with BPD. These groups provide a space where individuals can share their experiences, learn from each other, and gain support. Before we wrap up, I want to address a few myths about borderline personality disorder that can contribute to the stigma and misunderstanding. First, BPD is not a woman's disorder. While it's true that more women are diagnosed, men can and do have BPD too, and it can look different in different people. Second, BPD does not mean someone is crazy. People with BPD experience intense emotional pain and are often trying to cope with that pain the best way they know how. It's important to approach people with BPD with empathy, not judgment. Lastly, BPD is treatable. Many people with BPD experience significant improvement in their symptoms with therapy and support. It's not a life sentence. With the right help, people with BPD can manage their symptoms and lead fulfilling lives. To sum up, borderline personality disorder is a complex condition that affects a person's emotions, relationships, and sense of self. But with the right support, therapy, and treatment, individuals with BPD can thrive. If you or someone you care about is struggling with BPD or any mental health concern, please don't hesitate to seek professional help. If you found this video helpful, make sure to like, share, and subscribe for more content on mental health and well-being. And as always, remember, you're not alone. Help is available.